The NHS in England is responsible for 4 to 5% of the nation's carbon footprint. It's also the country's biggest employer. With over 1.3 million staff members, we have a huge opportunity to make a real difference. By working together to reduce the NHS's environmental impact, we could improve the health of our communities by slowing climate change, preventing further deaths caused by extreme heat, improving air quality and preventing respiratory disease, and encouraging active methods of transport, preventing obesity and promoting better mental health. So what part can we in the CCGs play? Our Sustainability Steering Group are developing a green plan and have already committed to reduce business mileage by 20% across all 3 CCGs by 2023-24, to work with our landlords to switch to 100% renewable energy suppliers by April 2021, to implement the NHS Plastics Pledge across the ICS, and to keep an eye on our progress via regular reports to the governing bodies and ICS board. We've already taken some important steps, including the rollout of efficient LED lighting and installation of electric car charging points at Aspen House. And as commissioners, we have a responsibility to ensure our providers do their bit too. In fact, to mitigate the effects of climate change and air pollution, the NHS Standard Contract includes a mandatory requirement for all healthcare providers to have a green plan in place which aims to achieve the national commitments set out in the NHS long-term plan. Our colleagues in acute care have been tasked with reducing carbon from their buildings and estates, reducing avoidable single-use plastics, switching to less polluting anaesthetic gases, adopting low-carbon asthma inhalers, and encouraging their staff to walk or cycle to work where possible. Our colleagues in primary care have a part to play too. Patient and staff travel makes up a significant proportion of an urban GP's carbon emissions. That figure can be massively reduced via further uptake of remote video and phone consultations. GPs could also aim to move away from the prescription of metered dose inhalers in favour of low carbon alternatives. A wholesale shift to lower carbon inhalers across the NHS would in itself reduce the organisation's carbon footprint by 4%. In fact, prescribing accounts for the largest proportion of primary care's carbon footprint. GPs and pharmacists can reduce this by ensuring their patients only take the medications they actually need. And we, as patients, can help avoid the need for medication by taking care of our physical and mental health and well-being. Combined with other practical steps, such as limiting reliance on single-use items and cutting down on printing and postage, these measures could have a real and lasting positive impact on our environment and communities. And what can you do? If we all pledge to make small changes, 1.3 million of us together, we can make a big difference.